Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Women. Next, coming into the investigations part. So what are the investigations that need to be done if you are suffering from any of this period irregularity? The first and foremost, the thing that has to be done is CBC, which is called as complete blood count, or you can also call it as hemogram. So why do you need this CBC? See, remember that if you're having prolonged bleeding or if you're not bleeding also properly, that can be because of iron deficiency anemia. If your iron deficiency anemia is there, then certain people will face scanty bleeding, and certain people, because of prolonged menstruation, can face iron deficiency anemia. So to know all of this, you should have complete blood count picture along with the iron profile to know the total iron binding capacity on all the other stuff about iron. And then why do you need to do a thyroid function test? Remember, thyroid hormone is one hormone that affects the whole of your body, like it affects every part. So any abnormality in the thyroid will result in uterine abnormal bleeding. So do get your thyroid tested if you're having abnormal uterine bleeding. Sometimes it may not be because of the uterus, it might be because of the thyroid also. So there is no structural problem in the uterus. There can be some sort of problem in the thyroid that is causing or making this uterine bleeding abnormal. So do get your thyroid tested. Coagulation panel. Why do you need a coagulation panel? See, remember, coagulation means the ability to clot. People who are having heart disease or certain kinds of diseases, doctors usually prescribe the blood thinners. So if you're using a blood thinner, you might face abnormal uterine bleeding. And also, if you're having hereditary problems with the coagulation, you're having low vitamin K deficiency also, then that can also lead into coagulation problems. So if you're bleeding, like even if you're having cold and you blow your nose, you're having this epistaxis, which is bleeding from the nose. And if you're cut and it's bleeding for a longer period of time, then all of this will come under coagulation problems. So do get it tested if you are having any of these associated symptoms along with abnormal uterine bleeding. Then coming to the imaging test, which is very, very important to know if there is any structural problem in the uterus. First one being the USG, that is ultrasonography of the uterus to know if there is any fibroid, polyp, or any other structural problems in the uterus. To know it more in detail, you can get an MRI or a sonohysterography done to see the in-depth picture of it. Next, coming into the other investigations, like if after the imaging and after the blood test is done, if you're not sure what sort of a disease it is, you can get a biopsy done, endometrial biopsy, to see what sort of problem, if there is any hyperplasia of the cells, that is, if there is too much multiplication, too much thickness, or if there are any cancer cells, we can know by doing a biopsy. What are the other tests? The other test is called as pap smear. So what is a pap smear? The picture you're seeing here is the pap smear. So why should you get a pap smear done? Remember that the percentage of people suffering from cancers, uterine cancer or cervix cancers, are increasing. So to do get a pap smear done regularly, and also if there is touch while doing a bimanual examination. If you're having any sort of sections of period problems, need bimanual examination. While doing a bimanual examination, even by just touching the cervix, if there is severe bleeding, then that can be because of some cervical cancer. It's not 100% sure, but usually on touch bleeding is because of cervical pathology. So to know that in clear, you need a pap smear done. If you're watching this video and if you're suffering from abnormal uterine bleeding, so you can consult us through online or offline options, as we are having good success rate in treating these diseases. If you are staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you are staying outside or you cannot reach us in person, you can contact us online either through audio call or through the video call. And also, after doctor consultation, you can share with us any sort of investigations that you've already gone through, and if we need any more, we will let you know. After all this doctor consultation, we will deliver the medicines to you, or the medicines will be sent through courier. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days, and across the globe, it can take 4 to 8 business days. If you're suffering from abnormal bleeding and you would like to get in touch with us, you can call us through this number. You can WhatsApp us, you can ping us or messages on this number. If you would like to know more about Fidicus Homeopathy, you can check this website www.fidicus.com. If you're suffering from uterine bleeding, if you're suffering from any sort of female complaints and you're looking for cure, why should you choose Fidicus Homeopathy? Remember, Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. Primarily, the reason for doing this video is the high amount of success rate we are having in already treating the uterine bleeding, that is abnormal uterine bleeding cases. The transparent treatment here at Fidicus, that is, there is no gray area between the person and the doctor. We will be educating you on the prognosis of the case, the cause of the case, and everything. And also the personal care here at Fidicus. So what is the personal care that we give? If you're sort of having any sort of, dilemmas, myths about this condition of yours, we will educate you on that. So if you want to choose cure, choose Fidicus Homeopathy. Thank you.